Are you one of those wonderful people full of compassion, patience, and endurance? And you're assigned to taking care of, maybe not assigned, but it's not even your choice to be the one taking care of an aging parent, a family member that is critically sick, a child with special needs on the autism spectrum, or the designated family member raising the grandchildren? Or are you caregiving for a loved one suffering with an addiction, cancer, PTSD, Alzheimer, or dementia? Are you the one who is financially secure and you are the go-to person in the family? You're like the ATM for everybody else? Well, today I want to talk about something called compassion fatigue. It is known as secondary trauma stress. And it can happen to you when you are shouldering a lot of responsibility and demands of your time, your money, your independence, your job, and your patience. Many of my counseling clients have this compassion fatigue. And I hear about the symptoms that they have, like isolation. They have physical ailments. They have bottled up emotions. And some even have substance abuse and reoccurring nightmares and flashbacks. Caregivers too often aren't even recognized. And they find it difficult to delegate or to ask for help, or they suffer in silence while other members don't even recognize that the caregiver is burned out, tired, becoming resentful, losing sleep, and losing money. I have now, and I've had in the past, clients, I would say that many of them fall in the category of having compassion fatigue. That's secondary trauma stress. And they have mixed feelings. This is what I'm hearing all the time, these mixed feelings of guilt and shame and resentment, questions and hurt. They're exhausted. They start having heart palpitations, high blood pressure. They feel so disconnected from their community, from their routine. They felt quarantined before the pandemic, during the pandemic, and some will be caring for others when the pandemic is over. I've heard so many painful stories of others taking care of their parent or both their parents. I mean, they want to do it. They love them. They love their child. They love their spouse. They love their sibling. But there is an emotional toll when you have this fatigue from being so compassionate and so accessible and so present that they start to begin to experience severe feelings like hopelessness and depression. They begin to feel agitated, irritable. They feel used, manipulated, forgotten, and unappreciated. And learning how to set their own boundaries is something I like to help them to do, to ask for help, to take care of themselves first, to keep their prayer life strong, to carve out some time in their day for meditation, for walking, talking with a friend, watching something funny or a movie that interests them. It's important that caregivers maintain vital connections and answer the phone when they can. And for those of you that know caregivers, don't judge them. Don't talk about your troubles. Bring them some food. Don't tell them they look tired. Be a good listener. But don't exclude them from invitations because they declined in the past. It's important that they still feel connected and seen. Too often when caregiving happens, friends scatter. So if you know someone who is a caregiver, reach out to them, remember them, call them, send them some cards, send some money, anything that would make them feel like somebody cares. Ask them specifically how you can help to lift the burden and give them a break before they have a breakdown. I'm Jewel Diamond Taylor, the Self-Esteem Doctor, and I thank you for watching and sharing this video. Would you please hit the like button on my YouTube channel and subscribe to learn more about my upcoming video messages. Be well, be blessed, be encouraged, and stay in the light.